Chest physician Dr. Timothy Kingondu has warned that the HIV pandemic is getting worse despite suggestions to the contrary. Kingondu says the decline on HIV awareness is to blame for the rise in new infections and said resources must be allocated to fight the scourge.
The only intervention for HIV infection which was available was health education and prevention. That seems to have gone down as drugs for chronic management of HIV became available. The health education will educate the person who is infected not to spread it. I am not happy with that campaign. That campaign has gone down. Instead of concentrating solely on treatment, we need to be able to introduce prevention mechanisms. And prevention mechanisms is to make people to be aware that they don't have to spread HIV.
The Nairobi hospital physician said HIV was fueling the cancer scourge in Kenya and urged the government to up the awareness campaign on HIV in a bid to take the escalating cancer cases in Kenya. Kingondu blamed rising cervical cancer cases to HIV and urged the government to step up the vaccination campaign on young girls to help reduce the potential cancer implosion.
Other sexually transmitted illnesses like human papillomavirus, it contributes also to cervical cancer in women, especially if you are infected with human papillomavirus type 16 and 18. That contributes to 70% of all the cancers. And that is also preventable because WHO has recommended that young girls should be vaccinated against these human papillomavirus, and I'm glad. I think the government is going to roll out that kind of vaccination. It's a good thing because it will prevent cancers down the line to those women. But vaccination has to be done before they have had their first contact, sexual contact. Otherwise, it's not going to be effective. In fact, almost all cancer of the cervix is caused by the human papillomavirus, or has got an association with the human papillomavirus.
Uzalendo News, I'm Faith Mutete.